Hello, my name is Tom Whitaker, and I'm a member of Group A for the Unit 2 Jigsaw activity. I will be identifying and following the blood flow from the femoral artery and its branches all the way through the thigh, leg, and foot. There's a lot to cover, and I could hardly fit it all onto one slide, so let's get to it. The femoral artery emerges from the inguinal ligament to supply the anterior compartment of the thigh. Shortly after the inguinal ligament, the deep femoral artery branches off of the femoral one. The deep femoral artery has three branches: the lateral femoral circumflex artery, the medial femoral circumflex artery, and perforating branches. Both the lateral and medial circumflex arteries have ascending and transverse branches, which contribute to the trochanteric and cruciate anastomoses, respectively. The lateral circumflex artery additionally has a descending branch that contributes to the genicular anastomosis of the knee. At the genicular anastomosis, the femoral artery provides a descending genicular artery. The popliteal artery provides one middle, two superior, and two inferior genicular arteries, and the anterior tibial artery provides a recurrent branch. Finally, the perforating branches flow from the deep femoral artery and supply all three compartments of the thigh: the anterior, medial, and posterior. Once the femoral artery emerges from the adductor hiatus of the adductor magnus, the femoral artery turns into the popliteal artery. The popliteal artery forks into two arteries: the anterior tibial artery and the posterior tibial artery. The anterior tibial artery follows the the anterior tibial artery turns into the dorsalis pedis artery at the ankle, running on top of the foot. From the dorsalis pedis, there are four branches: the lateral tarsal artery, the first dorsal metatarsal artery, and the arcuate artery, and additionally the deep plantar artery. The posterior tibial artery has a branch making the fibular artery on the posterior and lateral calf, and additionally, the posterior tibial artery forks into the medial and lateral plantar arteries. On the foot, the medial plantar artery supplies the medial foot and big toe. It will also anastomose with the deep plantar arch. The lateral plantar artery contributes to the deep plantar arch. It branches into the plantar metatarsal artery, the common plantar artery, and the proper digital plantar artery. At last, here is my question. A patient presents with a blockage of the lateral plantar artery near the medial malleolus. With this in mind, what artery will provide circulation to the deep plantar arch? Thank you for listening and have a good day.